Welcome, students, to today's lecture on the intricate complexities of breast cancer at the genomic and histological level. Breast cancer is a widespread and significant health concern affecting millions of individuals worldwide. Understanding the underlying mechanisms and recent advances in the understanding of breast cancer is crucial for both diagnosis and treatment. In this lecture, we will explore various aspects of breast cancer, including genomics, epigenetics, familial breast cancer syndromes, microRNAs, tumor heterogeneity, immunogenomics, liquid biopsies, immunotherapy, radiomics and breast cancer imaging, interventional radiology, oncoplastic breast surgery, and palliative care. So let us dive into the fascinating world of breast cancer research and discoveries. Breast cancer is a multifactorial disease influenced by both genetic and environmental factors. Genomic studies have revolutionized our understanding of breast cancer by revealing crucial alterations in the DNA of cancer cells. Advancements in high-throughput sequencing technologies have facilitated the identification of various genetic alterations, including mutations, amplifications, and deletions, in breast cancer genomes. These alterations can drive uncontrolled cell proliferation, invasion, and metastasis. Epigenetic modifications play a pivotal role in breast cancer development and progression. Epigenetics refers to heritable changes in gene function that do not involve alterations in the DNA sequence. DNA methylation, histone modification, and non-coding RNA molecules, such as microRNAs, are among the key players mediating epigenetic changes in breast cancer. Dysregulation of epigenetic mechanisms can result in the activation or silencing of oncogenes and tumor suppressor genes, contributing to breast cancer initiation and metastasis. Approximately 5 to 10% of breast cancer cases can be attributed to a hereditary component, with familial breast cancer syndromes being prominent contributors. Mutations in breast cancer susceptibility genes, such as BRCA1 and BRCA2, significantly increase the risk of developing breast cancer. Understanding these familial breast cancer syndromes is essential for identifying high-risk individuals and implementing preventive measures, such as regular screenings and genetic counseling. MicroRNAs, miRNAs, are small non-coding RNA molecules that regulate gene expression by binding to messenger RNA, mRNA, leading to its degradation or translational repression. Dysregulation of miRNA expression has been observed in breast cancer and is associated with tumor initiation, progression, and metastasis. The identification of specific miRNAs involved in breast cancer pathogenesis provides potential targets for novel therapeutic interventions. Breast cancer is known for its heterogeneity, which refers to the presence of distinct subpopulations of cancer cells within a tumor. Tumor heterogeneity poses a significant challenge in diagnosis and treatment strategies as different subclones have variations in response to therapies. Understanding the molecular and cellular diversity within breast tumors is critical for devising personalized treatment approaches and combating therapy resistance. Immunogenomics aims to understand the interactions between the immune system and the genomics of cancer cells. Breast cancer often evades immune surveillance by employing various mechanisms to escape immune recognition. However, recent breakthroughs in immunogenomics have led to the development of immunotherapeutic strategies, such as immune checkpoint inhibitors, which enhance the immune system's ability to target and eliminate cancer cells. Traditional tissue biopsies have limitations in terms of invasiveness, sampling bias, and intratumoral heterogeneity. Liquid biopsies offer a non-invasive alternative for analyzing circulating tumor DNA, XNA, circulating tumor cells, CTCs, and other tumor-derived components in body fluids like blood. These liquid biopsies provide valuable information about disease progression, genetic alterations, and treatment responses, enabling real-time monitoring and personalized treatment decisions in breast cancer patients. Immunotherapy has revolutionized cancer treatment by harnessing the power of the immune system to target and eliminate cancer cells. Breast cancer, particularly triple-negative breast cancer, has shown promising responses to immunotherapeutic approaches such as immune checkpoint inhibitors. Understanding the mechanisms of immune evasion and identifying predictive markers for immunotherapy response are crucial for optimizing patient selection and improving treatment outcomes. Radiomics refers to the extraction of a large number of quantitative imaging features from medical images, which can be correlated with tumor characteristics and patient outcomes. In breast cancer, radiomics analysis has shown promising results in predicting tumor aggressiveness, metastatic potential, and treatment response. Integrating radiomics into routine clinical practice could enhance diagnostic accuracy, risk stratification, and treatment planning in breast cancer patients. Interventional radiology techniques provide minimally invasive alternatives for breast cancer diagnosis and treatment. Procedures such as image-guided biopsies, radiofrequency ablation, and cryoablation offer precise targeting and effective tumor destruction while preserving surrounding healthy tissue. Interventional radiology plays a crucial role in the management of breast cancer patients, especially those who are not suitable candidates for surgery. Oncoplastic breast surgery combines the principles of oncological surgery and plastic surgery to achieve optimal oncological and aesthetic outcomes. It involves the removal of tumors with simultaneous reconstruction, taking into account tumor location, breast size, and patient preferences. Oncoplastic techniques have improved the cosmetic results of breast cancer surgery and enhanced patient satisfaction. Palliative care focuses on improving the quality of life for patients with advanced breast cancer by managing symptoms, optimizing comfort, and addressing psychosocial and spiritual needs. Palliative care should be integrated early in the treatment plan to provide comprehensive support, enhance communication, and ensure the best possible patient experience throughout the disease trajectory. Breast cancer research has made significant strides in recent years, uncovering intricate aspects of the disease's genomics, epigenetics, tumor heterogeneity, and immunological interactions. The advent of novel diagnostic techniques, targeted therapies, immunotherapies, and supportive care has ushered in a new era in breast cancer management. However, challenges remain, and further research is needed to unravel the complexities of breast cancer and develop more effective strategies for prevention, early detection, and treatment. As future medical professionals, your understanding of these topics will contribute to the ongoing battle against breast cancer and improve the lives of countless patients.